Welcome everyone to the Area Agency on Aging 1B Medicare Enrollment 101 webinar. And welcome to our Facebook Live audience. We're so excited to have you here. My name is Alex Harrison, and I'm the Communications Specialist at the Area Agency on Aging 1B. With me today is a great panel from the agency. We have Sherry Smith, our MAP manager for Area Agency on Aging 1B. We have Bev Clark. She's our MAP site coordinator for Macomb and St. Clair counties. And then we have Sharon Owateju, our MAP site coordinator for Oakland County. Today, we'll be taking a deep dive into what's new for Medicare in 2024, why you should review your plan every year, what to look for when choosing a plan, and how MAP can help you understand plan choices and potentially save you money. This will be recorded and the presentation slides will be available after we finish. So definitely wait until the presentation is over to put your questions in the chat. I'd like to turn the time over to Sherry now for our presentation, Medicare 101 and what's new for Medicare for 2024.
So what's new in Medicare 2024? And so what we will cover is what Medicare is. We'll do a brief overview of that. What's new for 24, as Alex mentioned, why you should review a plan each year, what to look for in choosing a plan. We'll tell you a bit about us and how we can help you understand your plan choices and potentially save you money. So what is Medicare? Medicare has four major parts. Part A is hospital insurance. That includes your inpatient care, your skilled nursing, your hospital care, and your home health care. Part B is your medical insurance, and that includes your doctor's visits, your outpatient care, your home health care, durable medical equipment, preventive services. And those two, Part A and Part B, are what we call original Medicare. Then there's the Part D plan, which is prescription drug coverage that you can add to your Part A and B. That includes your prescription medications and some vaccinations. There's also Part C, which is Medicare Advantage, and that's what you see mostly being advertised on TV right now. And that's your Part A, B, and D rolled into one plan. Those are HMOs and PPOs, and they may offer extra benefits to you as well. So there's two paths, as I sort of mentioned, to go on as you choose Medicare. You can choose your Part A and B, original Medicare. You can add prescription drug coverage. Medicare calls it optional, but the fact of the matter is that if you don't have prescription drug coverage and you go to get it, you're going to get stuck with penalties. So it's optional for you if you want to have penalties, but it's really recommended that you get it. And then there's a number of things that Medicare doesn't cover, so people may choose to add a supplement or a Medigap plan. Those are lettered, but those are called plans, and Medicare are parts, so it can be confusing. So just keep that in mind. The second path you can choose is to go with a Medicare Advantage plan. And as I mentioned, those are HMOs or PPOs. They include your hospital insurance and your medical insurance, plus they almost always include prescription drug coverage. So what are the updates for 2024? And Bev, you can actually skip 2 slides to the second slide here. So in Part A and B, the deductible has increased from 164. The Part B deductible has increased from $164.90 to $174.70. It's a $9.8 increase. It's approximately 5.5%. The 2024 Part B premium went up to $240, which is from I'm sorry, from $240 to $226. Let me back up. The 2024 Part B premium went from $226 to $240, which is a $14 increase. The deductible that beneficiaries pay when they're admitted to the hospital went from $1,600 to $1,632. The Part A deductible covers beneficiaries' share of costs for the first 60 days of Medicare-covered inpatient hospital care in a benefits period. Beneficiaries have to pay an additional $408 coinsurance for days 61 through 90 and $816 per day for hospital stays beyond the 90th day. This is why people frequently choose a Medigap plan to go with their A and B, because the Medigap will pick up most of those costs. For beneficiaries who are in a skilled nursing facility, the daily coinsurance for days 21 through day 100 went up to $200. For the small number of beneficiaries who pay a Part A monthly premium, their monthly bill can be up to $600, I believe, in 2024. I don't believe we have that current number yet. And it's a very small number of people who haven't worked 10 years or 40 quarters. So thank you. Next slide, please. When you're enrolling in Part D, there's a few things that we ask people to remember. One is to look at your costs, your deductibles, and your copays, your premiums, your deductibles, and copays, and the senior savings model, which is actually the insulin plan, which I'll discuss a little bit more further down. You want to know if your drugs are covered. Are there tiers? What tier your drug might be on? Do you need prior authorization? Are there quantity limits? Are there step therapies? Step therapies are when your doctor says, or when the insurance says you have to try this drug before you can get that drug. If you're interested in traveling, you want to make sure that you've got nationwide coverage. Is your pharmacy in network or preferred? Do you like to get mail order? We recommend everybody get a benefits checkup every year, even if they're happy with their plan, because your formulary can change, your doctors can change, your medications can change. It's always good to take a look and make sure you're on the best plan for you, and you may end up saving money. And this is what our counselors are really skilled to help you with. They can help you go through all of this. If everything's good, it's a short visit. If things aren't good and you want to make a change, then we are here to help you. Medicare Advantage plans, there's also things that you want to consider. Again, you want to consider premiums, deductibles, and copays. There are zero premium plans this year. The insulin savings model. Are your drugs covered? What tier are they? Again, prior authorization, quantity limits, and step therapy. Your pharmacies. But there's another thing that you really want to take a look at with the Medicare Advantage plan. Are your physicians covered? Both your primary care and your specialists. Are they in or out of network? Will your plan pay for things that are out of network, or do you have to stay in the network, which is generally something with an HMO? And do you need a new plan because of that? Additionally, there's things that people think are important, and indeed they are. Things like dental, vision, and hearing benefits. Most plans provide some sort of dental, vision, and hearing benefit with the plan, but there's often separate insurance riders where you can get some additional benefits, and those cost extra. There's also fitness benefits, transportation, telehealth, and more. And all the plans are different. They change things up each year. So you want to be able to check on those things too, if that's important to you, because original Medicare doesn't cover those things. And that would be Part A, B, and D. So that's what you would get with a Medigap plan. I'm sorry, I'm trying to advance my slide. Okay, so the Medicare Advantage open enrollment period is from January 1st If you have a Medicare Advantage plan effective, this should read, I apologize, January 24th, and you have another open enrollment period, January 1st through March 31st. At this time, if you're unhappy with your current Medicare Advantage plan, you can change to a different plan or change to original Medicare with Part D. However, you have to have a Medicare Advantage plan in order to use the Medicare Advantage plan open enrollment period. I will get to this a little bit later, but you also can change your plan during the annual open enrollment period, which we are in right now. So Medigap updates. Medigap plans are available if you purchase, if you enroll in Medicare and take original Medicare Parts A and B. Medigap helps pay for the coverage gaps that Medicare A and B don't cover, such as co-pays, co-insurance, first 3 pints of blood, and other things. If you have a Medicare and You 2024 book or even a 2023 book, you'll find a chart around page 74 or 75. There are also select plans that are available to Medicare beneficiaries who are under 65 and disabled, but not all plans are available to people who are disabled. There's no major changes to Medigap this year, except for the following. The out-of-pocket limits for plans K and L have increased to $7,060 and $3,530 respectively. These two plans cover many things at either 50% or 75%. I do have to say, in almost my 6 years of working with this program, I have never seen anyone with or anyone purchase a K or an L plan. So I wouldn't worry too much about those prices. In the last couple of years, Medigap plans have been allowed to offer some additional benefits like dental, vision, hearing, and gym memberships. These programs are available to purchase with the policy or a discount program provided with the Medigap plan. Our program, again, can help to assist you and understand the different Medigap plans, and we can help provide you with estimated costs and help connect you to companies that sell these products. We can't enroll you directly in these plans, but we can give you a really good estimate because there's a lot of different plans and you don't want to have to be calling 20 plans to see what the prices are and what you can get. So we can help you with that. So Medicare and You 2024 has a number of different changes about the Medicare program in it. These are in the very beginning of your Medicare 2024 book. So starting January 1st, 2024, if you have Medicare drug coverage Part D and your drug costs are high enough to reach the catastrophic phase, you don't have to pay a copayment or coinsurance. I'll talk a little bit more about this later on. Extra Help is a program that helps cover your Part D costs, and it's going to expand to cover more drug costs for people with limited resources and incomes. Again, I'll talk about this going a little later. And coinsurance for some Part B covered drugs may be less if a prescription drug price increased higher than the rate of inflation. This is part of the Inflation Reduction Act, and it's something that's going to help keep costs down. There are now lower costs for insulin and vaccines. Your Medicare drug plan can't charge you more than $35 for 1 month's supply of each insulin product that Part D covers, and you don't have to pay a deductible for it. This is really good news because if any of you are diabetic or know people who are diabetics, these costs were crazy high in the past. So now it's $35, it's capped. If you take more than one insulin product, you'll be paying $35 for each product, but each product will only be a max of 35. If you take insulin through a traditional pump that's covered under Medicare's durable Medicare equipment benefit, then insulin is covered under Part B. And again, you won't pay more than $35 for a month's supply, and the deductible doesn't apply. However, certain products that, like Ozempic, for example, are not considered insulin. Those are injectables, and those costs are still pretty high, but we're going to see them come down in coming years. And now, something that's also really good news is that recommended adult vaccines are now available at no cost to you. That includes everything, Shingrix, COVID, and more. A few more things on that. There are changes to your telehealth services that you can still get telehealth through the end of 2024. After that, you have to be in a medical facility or an office to get most telehealth services. And there's some exceptions like mental health. There's better mental health benefits now too. Starting in January 2024, Medicare will cover intensive outpatient programs provided through hospitals, community mental health centers, and other locations if you need mental health care. You also are going to have more time to sign up for Medicare if you recently lost or soon lose your Medicaid. You may be able to sign up for Medicare or change your current Medicare coverage. There are other special situations that will allow you to sign up for Medicare. And COVID-19 will continue to be covered for the vaccine, some tests and treatments to help keep you safe. So Medicare has different enrollment periods, but there's no continuous enrollment for Medicare Part D drug benefits or Medicare plans. So most beneficiaries have a limited time frame to enroll in, disenroll from, or switch their Part D plans. There are three basic enrollment period categories: initial, annual, and special enrollment. In general, your initial enrollment period for Medicare is the 7-month period, 3 months prior to your 65th birthday, the month you turn 65, and 3 months after. If you're under 65 and have been on a disability, your initial enrollment period is the 25th month of disability. But there are different circumstances that affect when you can enroll in Medicare, including when you plan to draw Social Security, if you are still working, and other factors. As always, this is something to contact on if you have questions about your enrollment, because we can help you with the answers so you are all set. Because it's very important to enroll in Medicare on time, as there's late enrollment penalties for both Part D and Part B, and these penalties follow you through the rest of your life. So that was initial enrollment. And now I want to talk about the open enrollment period, which is also known as the annual election period. If a beneficiary, or if you want to disenroll from a Part D or Medicare Advantage plan, you can change to a new plan during this time. An enrollment change that occurs during this time will automatically disenroll you from your previous plan, with your new plan becoming effective January 1st of the following year. Open enrollment is always October 15th through December 7th, and that's the period we are in right now. And as noted earlier, people who have Medicare Advantage plans on January 1st are also eligible to change their plan one time between January 1st and March 31st. Something to bear in mind is that you must have credible coverage, which is coverage at least as good as what Medicare provides, in order to avoid penalties unless you qualify for Medicaid or other low-income programs. And generally, in these circumstances, there are no late enrollment periods. So now I want to move on to special enrollment periods, which are circumstances that happen when people have a change of life or other factors. So next slide, please. Special enrollment periods enable beneficiaries to make Part D plan changes in special situations, including an involuntary loss of credible coverage. For example, if you lost your job, if you're moving, or other exceptional circumstances. Medicaid or people with low-income subsidies can have a special enrollment period. They can join or switch plans once per calendar quarter. And COBRA. COBRA is not considered credible coverage for Medicare Part B. Drug coverage may qualify for a special enrollment period into Part D. So it's really important to understand that, because a lot of people take COBRA and then they end up with a late enrollment penalty. So please contact us if there's a reason that you might be going on COBRA, and we can help advise you as to the right tactics to take. There's other special circumstances to know about, such as people who are automatically enrolled in a plan by Medicare, which occasionally happens. If there's an error from a federal employee, you do get a first-year trial period for a Medicare Advantage plan. If you don't like it, you can change back and get a special enrollment period. If you're switching to or from a PACE program, which is a program of all-inclusive care for the elderly, and if your employer group health plan would otherwise allow you to make changes to your plan. There's other reasons why you should take going back up to Medicare drug coverage instead of or in addition to COBRA. If you take COBRA and it includes credible prescription drug coverage, you'll have a special enrollment period to join a drug plan without penalty when COBRA ends. So we all know that there's been a public health emergency because of COVID. And in May of this year, President Biden declared the public health emergency over. They called it the public health emergency unwinding, and the SEP is a special enrollment period. Something that's important to remember is that for individuals who did not sign up for Medicare when they turned 65 and have now lost Medicaid, can enroll in Medicare with a special enrollment period. Medicaid was not disenrolling period during the public health emergency. And now Medicaid is doing redeterminations, and some people may find themselves without benefits. The special enrollment period for Medicaid people is available for up to 6 months after an individual's Medicaid coverage ends. The individual can choose to have Medicare coverage begin either the month after they enroll in Medicare or retroactive to the date that their Medicaid ended. There will be no late enrollment penalties. However, beneficiaries who would choose retroactive coverage may have to pay premiums. So a few things to remember about enrolling in any plan. If you don't enroll on time and/or you don't have credible coverage, which is as good or better than what Medicare provides, you may be subject to penalties. If you have a Medicare Advantage plan with a separate rider for dental, vision, and/or hearing, and you switch your plan, you have to cancel your rider separately. It doesn't automatically cancel when you change your plan, and you will be paying for something that you're not getting. If you switch from a Part D with a Medigap to a Medicare Advantage plan, you have to cancel your Medigap policy. It will not automatically cancel, and you can't have both a Medicare Advantage plan and a Medigap plan at the same time. Again, it's always good to talk to us before making changes. We can walk you through the process and help ensure you're not left with unnecessary expenses or hassle. And I want to emphasize with the Part D that if you are switching from a Part D with a Medigap to a Medicare Advantage plan, you want to think about that very carefully, because you will not be able to get your Medigap plan back at the price that you had it for. So it's really important to understand the implications of making that change before you make it. So Medicare and employee coverage, this is a question that we get asked about a lot. And whether Medicare pays primary or secondary to employee coverage depends on the number of employees. If your company is less than 20 employees, your employer plan is generally secondary to Medicare. If you delay enrolling in Part B, you may find that you have a gap in coverage due to coordination of benefits and end up with a late enrollment penalty. The penalty will follow you for as long as you are on Medicare. When you are working, we suggest that you speak with your HR benefits coordinator department for more information. If you have a health savings account and will soon be eligible for Medicare, it's important to understand how enrolling in Medicare will affect your health savings account. If you're enrolling in Medicare Parts A and B, you cannot contribute pre-tax dollars to your HSA. So you have to stop contributing the month your Medicare coverage begins. You can still withdraw your money tax-free to pay for qualified medical expenses, and Medicare would pay primary to the job-based coverage. However, if you're still working and you're delaying enrollment into parts A and B, receiving healthcare coverage from an employer with 20 or more employees, and want to continue putting funds into your HSA tax-free fund, you can use a special enrollment period when you're ready to enroll in Medicare. However, you have to stop contributing to your HSA at least 6 months before you enroll in Medicare. There are 4 main takeaways to this. This is a pretty complicated topic. So you need to delay in Social Security benefits and decline Part A if you wish to continue contributing funds to your HSA. 2 is if you decide to delay enrolling in Medicare, make sure to stop contributing to your HSA, as I mentioned, at least 6 months before you do plan to enroll in Medicare. This is because when you enroll in Medicare Part A, you receive 6 months of retroactive coverage, not going back farther to your initial month of eligibility. If you do not stop contributing to your HSA at least 6 months before, you may incur a tax representative. We also highly recommend that you speak with your HR representative or tax professional regarding how your HSA will work with Medicare. We can guide you through some of it, but ultimately it is a really complicated and serious topic, and we want to make sure you get the best information, and your HR representative or tax professional will be able to help you best with that. And I know I said there's 4 main takeaways, but I was teasing. There's really only 3. So for people who have higher incomes, they may find that they have to pay an income-related Medicare adjustment amount. So meet my friend Irma. Part D premiums are subject to income adjustments. Beneficiaries with significant income will pay on a sliding scale a higher Part D premium. The IRS looks at tax returns from 2 years prior. There's 6 income categories, and each category has a set dollar amount associated with it. For incomes over $103,000 for a single individual or $206,000 for a joint modified adjusted gross income, that's when you have to start paying IRMA. And here's a chart that shows what the Part D IRMAs are. And the PP is plan premium. So for example, if you are making $103,000.01, whatever Part D premium you get for your plan, you're going to have to pay an additional $12.90 on top of that every month for your Part D. And the next slide shows your Part B premium, which goes through the same thing. So starting in 2024, your Part B premium is going to be $174.70 for most people. But if your income is higher, you'll start paying at $244.60 a month for your Part B premium. We can send you these charts. I believe you all have the PowerPoint, so you can look those over, and feel free to call us if you need help on that. So we've all heard about the donut hole, and we've heard that the donut hole is going away, and essentially it has. And this slide indicates how Part D drugs are paid for. So Medicare prescription drugs may offer one standard coverage, including tiered copayments or coinsurance or lower deductibles. Your deductible period is the period that you pay your Part D until your deductible is met. In 2024, deductibles can't be higher than $545 a month, or I'm sorry, a year, and some plans have no deductibles. Once the deductible is met, you go to your initial coverage period. And that is when the plan will start helping pay for your prescription drug coverage. The plan will pay some of the costs, and you'll pay some of the costs, a copayment or coinsurance. How long you stay in the initial coverage period depends on the drug costs and the plan's benefit structure. For most plans in 2024, the initial coverage period ends when the beneficiary has accumulated $5,030 in drug costs. that is the amount that both you pay and the plan pays. At that point, you enter the coverage gap. And that is what is also known as a donut hole. When you enter the coverage gap, you'll be responsible for 25% of the cost of drugs. That's the purple area on this chart. There may be a difference between the initial coverage period and the donut hole. For example, if your total cost of for a drug is $100 and your plan has a copay of $20 during the initial coverage period, you're going to be responsible for paying $25 during the donut hole or coverage gap period, because that's 25% of the cost of the drug, which was $100. Once you meet the maximum amount for the donut hole, you enter what's known as the catastrophic coverage phase. And for all Part B plans, you enter this after you've reached $8,000 in out-of-pocket costs for coverage drugs, or Medicare has been billed $12,447.11 in retail costs for the drugs. This amount is made up of what you've paid for the covered drugs, some costs and costs that others pay. During the catastrophic period, you will no longer have to pay for your covered medications for the remainder of the year. It used to be that you'd have to pay 5% of the cost of your drugs. Now you don't have to pay anything. What's counted in your out-of-pocket is your deductible, what you've paid during the initial coverage period, almost the full cost of the brand name drug, including the manufacturer's discount purchased during the coverage gap, amounts paid by others, including family members, charities, and people who are assisting you, and things that are paid by like state pharmaceutical assistance programs, Indian Health Services. So should you reach that phase, you won't be paying for your drugs anymore. Now we've seen the amount that people have to pay if they have higher income, and now people who have lower income may qualify for extra help or a low income subsidy. This is a subsidy that's provided by the Social Security Administration. It helps with the cost of Part D prescription drug coverage, premiums, deductibles, and copays. In the past, in 2023, there was a partial low-income subsidy and a full low-income subsidy. The partial low-income subsidy is going to be eliminated in 2024. Individuals who are receiving a partial subsidy will be automatically assigned the full subsidy by the Social Security Administration. This benefit is part of the Inflation Reduction Act of 2022, and it's going to be a real welcome help to people who have lower incomes and can't afford their prescription drugs. And this slide, I apologize, is out of place, but we mentioned it before that on the coverage gap, but it does bear repeating that when you reach the coverage gap, you'll pay a maximum of 25% for your generic medications and 25% for your brand name medications. So the Medicare Plan Finder, this is a tool that we use and you can use to shop for all things Medicare. It's located online and allows you to create a personalized account. With your personalized account, you can have access to all things Medicare, like your summary notices. You can pay your Part B premiums. You can get a personalized plan tailored to your needs and more. This is what we at MAP use to help you find the right plan. We highly encourage you to create a login with Medicare's Plan Finder, but we understand it may not be the preference for anyone. You can still do an anonymous search for your plans. We also encourage you to work with us when you are looking at the Medicare Plan Finder, because there are certain things like filters, adding in pharmacies and such that can really make a difference in the cost of the plan that you decide to choose. And we want to make sure that you choose the right plan, which would be the plan that covers all your drugs and/or doctors and is at the lowest cost and is at pharmacies that you like to shop at. But we have seen differences in hundreds of dollars between one pharmacy and another. So it's really important that you talk with us or really understand the plan finder so that you choose the right plan. So the Medicare Plan Finder also has a star rating system, and it rates the plans based on customer service, member complaints and problems, getting the services that they want, members' experiences with the drug plan and drug pricing. And the Medicare Advantage plan ratings also include the screenings, managing chronic conditions, plan responsiveness, and more. Medicare reviews those plans yearly and releases new star ratings in the fall, and plan ratings can change from year to year. But before considering the star rating, make sure that the coverage and costs suit your needs. For example, if you're considering a Part D plan, make sure all your drugs are covered before you pick a plan, regardless of star rating. And in an effort to promote better plan quality and better choices, Medicare will be sending notices to people who are in a Part D drug plan or a Medicare Advantage plan that fails to get at least a 3-star quality rating for 3 straight years. The notice lets them know that they are eligible for a special enrollment period to enroll in a 4 or 5-star plan. So low performing plans. Medicare is also disabling the online enrollment feature for in the plan finder for low performing plans that have 3 or fewer stars. These plans will have a low performing icon along with a message warning you that the plan's poorly rated performance. So if you want to enroll in a plan that has less than 3 stars for 3 consecutive years, you're going to have to enroll directly by calling the plan or calling Medicare. You will not be able to use the plan finder for those plans. So every year around this time or a little bit earlier, people will get an annual notice of change in the mail or an ANOC. And this is because Part D and Medicare Advantage plans change their benefits and costs annually. Be sure in the ANOC to check if your premiums, deductibles, and co-payments changed. Are your drugs still covered? Are your drugs still covered on the same tier? Are there restrictions to your drugs? And then using the plan finder, you can see if there's another plan that might offer you better coverage. And again, these are things that we are more than happy to help you with. So in 2022, President Biden signed the Inflation Reduction Act, and there's a number of prescription drug provisions in it. In individuals who find themselves, as we mentioned earlier in the catastrophic phase, will now receive their medications at no cost. All Medicare vaccines, regardless of whether they are covered by Part B or Part D, are now free of charge. Insulin is now capped at $35 per medication per month. People receiving a partial extra help subsidy to pay for prescription drugs will now receive the full subsidy, which is an increase to 150% of the federal poverty level. And something new that we haven't discussed is that Medicare is now able to negotiate the price of some drugs. We will see those changes in 2026. But some of the big hitter drugs are going to be the ones that the prices will be negotiated for, and we'll see those prices lowered. And another thing that's going to be really important to know is that in 2025, there's going to be a $2,000 cap on out-of-pocket expenses for Part D. Currently, there's no limit to how much you can pay for your drugs if you have a Part D plan. Medigap plans don't cover prescription drugs, so the sky is truly the limit. So starting in 2025, there'll be a $2,000 cap. And this is particularly important for people who are going to be new to Medicare, who might be considering a Medigap policy. They don't want to miss their initial enrollment period for Medigap. And so if you're considering it, and it's very expensive for the first year, you may want to think and say, can I make it through the first year so that next year I can get the plan with the $2,000 cap? So those are some things that are really new and exciting in terms of helping people save money on their Medicare. This next slide shows the timeline of the Inflation Reduction Act rather. In 2023, there was the $35 cap on insulin. There was a reduction in vaccine copays, and there was a provision that drug companies had to pay rebates back to Medicare if the drug prices rose higher than 6% than the rate of inflation during the year. 2024, which is down below, it eliminates the 5% coinsurance for the Part D catastrophic level and expands the low-income subsidy eligibility. As I just mentioned, in 2025, we're going to see the out-of-pocket max for Part D go to $2,000. And I should mention Medicare Advantage plans all have out-of-pocket maximums. They vary, but they all have them. Part 2026, we're going to see a negotiation of 10 drugs. 2027, we're going to see a negotiation of 15 more drugs. 2028, 15 more, and in 2029, 20 more drugs. So that's going to be really important because a lot of these new drugs that are coming out on the market are out of reach for people. So this is really going to help save money. I realize it's planning down the road, but it's good to know, and I'm glad it's going to happen. So a couple more things that I want to discuss. We are what is called the Senior Medicare Patrol for the Medicare program. It's a national program that helps keep seniors safe. Seniors are being targeted by scammers in greater numbers than ever. And so this program is funded by federal dollars to help people. The MMAP program across the state is the Senior Medicare Patrol for Michigan. And if you think you've been a victim of a scam and want to report it or get some help, you can call us at the number listed 800-803-7174 or send an email to us at map@aaa1b.org. There's also this year some new marketing guidelines that have come up to help keep you safe. Medicare plans cannot market themselves as Medicare endorsed. Medicare does not endorse any plans. So if they're marketed that way, please know they are not. They cannot solicit from door to door or go door to door and leave materials on your doorstep or mailbox. They can't call you if you're on the national or state do not call list. And I realize many people are still getting calls. You have to periodically go back to the do not call list and put yourself back on. They can't enroll people over the phone during a solicitation call. So if you have a plan A and there's other plan A's available, and I'm just using the number A or letter A, they can't enroll you during that. They can't market you outside the plan service area. They can't make unsolicited calls, and they can't even leave a voice message for you. They can't approach you to market in a public place like a grocery store or park. And we know that seniors are being bombarded by TV and print ads offering pie in the sky deals. We also know it's a time when scammers, as I mentioned, are out in full force. Don't trust mailers that appear to be government communications. Remember that agents and brokers selling Medicare Advantage or Part D plans are not allowed to do certain things. Never give your Medicare number or other personal information out to callers or visitors, even if they say they're from Medicare. Medicare will not call you. So if they say they're from Medicare, you can hang up the phone because it's a scam. And again, these plans are not approved or endorsed. And you can get information on Medicare plans without providing any kind of ID number. And don't rely on caller ID, because with AI, people can make it look like they are calling from a legitimate business or industry or government agency. And so don't rely on it. If someone wants to talk to you, they're going to leave you a message and you can call them back. Some other safety rules: if you get an email or text message, for example, that says a product that you ordered is waiting for you and all you have to do is verify your address. Don't do that. If you actually ordered something, let's say from Amazon, and you get a message from Amazon saying there's something wrong with your order, go to their website directly. I realize it's not a Medicare tip, but it is a tip to keep you safe. And the ads on TV and radio generally have disclaimers that are written or read very, very fast and in very small print. Don't call the numbers that they state. They may be legitimate, or you may be scammed, and you quite possibly may end up with being enrolled in a program that you don't want, and you're probably not eligible for all the services that they provide. Those are things that you find out when you read the minuscule print. If you're interested in a specific plan that mentions items in an ad, give us a call. We'll help you determine what you're eligible for, and if that's a legitimate plan, we can help you enroll. Medicare also covers a number of preventive services in Part B, and we want you to know a little bit about them to help keep you safe. They are also covered by Medicare Advantage plans, and they help find problems early when treatment works best. You don't pay anything for most preventive services, although there may be a coinsurance for an office visit, and you may pay more from a provider who doesn't accept Medicare assignment. And Medicare Advantage could require a co-payment. These next couple slides are just examples of what Medicare covers and what the costs are. So for example, a mammogram is covered every 12 months for women 40 years of age and older. It costs you nothing. Prostate cancer screenings are covered every 12 months for men over 50. There's no cost for the test. However, there could be a 20% doctor's visit or copay. All your vaccines are now covered at no cost. Glaucoma is covered every 12 months if you're at high risk glaucoma tests. Diabetes screenings are covered. So there's a number of things that are covered. People don't tend to take advantage of all the wellness and preventive services that Medicare does cover. So if you're not sure if something's covered, you could give us a call. We can let you know. And we encourage you to take advantage of these services. So I know I've said it all along, and I'll say it again. A MAP counselor can help you understand your Medicare health plans. We can help you compare and enroll in your Medicare Advantage plans. We can compare and enroll prescription drug coverage. We can help you identify and report Medicare fraud and scams. We can help you enroll into low-income programs like low-income subsidies and extra help. Please know we are not an insurance company. We are not affiliated with any insurance companies, and we are not licensed to sell insurance. Our only job is to help you get the best plan at the lowest cost. We don't get commissions. Again, we are only here to help you. We work primarily through volunteers, and we have a cadre of over 100 of them in our 6-county area. And they are highly trained. They go through hours of training and constant updates, and they are really, truly dedicated. So we encourage you to take advantage of them, especially now because we are in the open enrollment period. And if you call us at 800-803-7174, we'll be able to make an appointment for you. And remember, open enrollment is December 15th through December 7th. This is the only time really you can change your Part D plan. Medicare Advantage plans have a little bit more time. And I want to apologize that there are a few buttons that you have to press to get to us. The first thing when you call, they're going to ask for your zip code, and that's to route you to the right area agency on aging. And if you get voicemail, please leave us a message. We will call you back. We get over 100 calls sometimes in a day. And so it's kind of hard to get to everybody all at once. So we are really the best resource for information. As I mentioned, our services are free and unbiased. We are not sales agents. We can't sell you anything. There is no question that's too small or a question that's too difficult. And we have saved beneficiaries over $2 million in the past year. So with that, I'm going to turn it over to questions and answers and to Bev and Sharon. So thank you so much for tuning in.
Hi, Sherry. This is Kathleen. This is Kathleen Yannick, and I'm the communications manager here at the agency. And I just want to offer up a quick apology to anyone who had difficulty joining the webinar today. There was supposed to be an automated email that went out with a link, and it looks like that did not happen. So sometimes we have those technology issues, and I did want to offer an apology and let you know that if you missed any part of today's webinar, we are going to be emailing that out to you, to all our registered participants. So you will get the full recording. And now, again, I'm so sorry, and I will turn it over to our lovely panel for all their questions.
Thank you, Sherry, and thank you, Kathleen. We do have a question in here. It says, I am leaving a job on November 1st and apply for Medicare Part B on September 19, 2023, and have not received a Medicare Part B card. Can I enroll in a plan without having a Medicare Part B card? Sharon, would you like to answer that?
Sure. To enroll into Medicare and take advantage of the hospital and doctor services, it is recommended to have Part A and B. The card does arrive like within 30 to 45 days, so you may still be in that period to getting your card. But if you have created an SSA account, you can go into the into your account and see if you have been provided that number to enroll into Medicare. Bev, if I missed anything?
Nope, I think you got it, Sharon.
Okay, thanks.
This is Sherry. I just want to say one other thing. If you are trying to get into a plan effective November 1st and you haven't received your card by the end of October, which you probably won't, you can also give us a call. Sometimes we're able to get hold of Medicare and see if there is a number for you, and then we can help you out. It doesn't always work, but we can often try.
So thank you guys so much. I'm trying to get back to the chat box, but it seems like I'm having some issues. So give me just one moment, please.
Hi, this is Kathleen again, and I don't think we have any additional questions in the chat box, Alex, but I do have one that I'd like to ask the team, and maybe we can spotlight them again. Is that I would like to know, like, from your personal experience, what is the most common mistake that you see people making?
Well, I can comment on that. I think the most common, and it's not really a mistake, it's a matter of lack of information, which is why we do public presentations. People who are stuck with a late enrollment penalty, especially for that prescription drug coverage. Many people perceive that if they're enrolling in Medicare, but they don't take any prescription drugs, that they don't need a prescription drug plan. But we highly encourage people, look for a plan that has a zero premium, or maybe only costs $2 or $3 a month. If you enroll in that when you first enroll in Medicare, you avoid ever being assessed that late enrollment penalty for not enrolling in Part D.
This is Sherry again. I know I wasn't doing the chat, but I can't resist. The biggest mistake I see is people choosing a plan because someone told them this is the best plan to get. Their husband, their neighbor, a friend, and it might be the best plan for them, but it isn't necessarily the best plan for you because your medications might not be covered on it. So remember that Medicare is personal to you. And yeah, and if you get the plan that somebody else has and it doesn't cover what you need, it's a big mistake.
Right, and we can take a look at that plan if a neighbor really highly recommends it. You know, we'll help you compare that with other things that are available for you.
Absolutely.
And
Perfect.
I was mistaken, Alex. This is Kathleen again, and we do have a couple more questions in the chat. And if you can't see them, I will read them out for no problem. Carol
I
had.
can now. I don't know what's going on.
I'll let you take it then.
Okay, awesome. Thank you. The next question is, will I be covered on November 1st when my insurance provided by my employer ends? Sharon, would you like to answer that?
Oh, yes, we answered that one.
Oh, okay.
I'm
Sorry
sorry.
about that. It's like a part B to that. So the next question is, have you ever heard of United Medicare Advisor? They're in St. Clair County.
I'm sorry, have heard of what?
United Medicare Advisor.
There are a lot of companies out there who give themselves sort of generic names like Medicare Advisor, Medicare Cooperative, those sorts of things. We try to research them as they come across our desk, or MAP Inc. in Lansing researches them. Invariably, you're going to find a program like that is an insurance broker. They are allowed to offer educational presentations in the community, but they will also provide, they will also do sales pitches. They will also collect your name and address. You've already met them in an educational program, so they can contact you later and try to sell you something. The Michigan Medicare Assistance Program is the only program in the state that is completely free, completely unbiased, and we are trained by the state to provide that unbiased information for you.
The next question says, regarding Part D, incredible coverage for someone receiving benefits from work, we filled out employer complete CMS L564 to get Part B. Is this something similar required? Is something similar required for Part D?
A company should provide you a letter that your Part D coverage is creditable coverage. You would ask your benefits administrator for that letter. In addition, to avoid the late enrollment penalty on Part B, like boy, the form from Social Security needs to be filled out again by your benefits administrator. And you submit both of those when you enroll in Medicare to prove that you have had creditable coverage.
Looking at the chat here to see if we have anything else. It doesn't look like we have any other questions at this time. I do want to thank all of our panel and of our site coordinators, and Sherry, our MAP manager, for answering our questions today, for presenting. And thank you, a big thank you to those who helped run the show behind the scenes, even though we had some technical difficulties. Thank you to all of those who could attend today and for your patience. That is all the time that we have today, but if you have any more questions, definitely give us a call. I'm going to try to share my screen here so you can see the number. Try to call 1-800-803-7174, or to make an appointment with one of our free and unbiased enrollment counselors. You can visit aaa1b.org/events to find an appointment near you. As a reminder, a recording of today's webinar will be available after, as well as presentation slides for you to share with family and friends. Thank you so much for joining, and I hope you have a great day.
Thank you, everyone. Bye-bye.